The Philippines is a widely recognized disaster-prone country. In previous years, we require improvement in terms of avoiding disasters, saving lives, or mitigating the effects of disasters. To address the existing gap in service delivery, the University of the Philippines Manila has set up a Disaster Risk Reduction and Management for Health Center in cooperation with the Department of Science and Technology or DOST. This shall serve as the Center for Excellence in the academe pertaining to DRMH related issues. The research component was led by the Health Emergencies and Disasters or HEAD study group, which is a group of researchers whose main goal is to conduct research related to emergencies and disasters. The NICER program of UP Manila consists of three different projects. The creation and pilot testing of disaster resource mapping and damage assessment software has developed what we call iligtas with the integration of the PDCAT or the Preliminary Damage Cost Assessment Tools. Iligtas is a web-based and Android app-based software which can hopefully assist victims and their families during disasters by allowing them to request for help or send a report on an incident. Hopefully, it can also provide assistance to emergency responders during their missions through geolocation, real-time updates, and identifying available resources. The project on mental health triaging for evacuation center and camp management developed Unahon, a behavior observation checklist for resource prioritization. It will formalize an emergency mental health triage system designed for our Filipino camp managers in evacuation centers. It is a user-friendly tool which does not require higher level of training. This prioritizes the internally displaced person's mental health state by color coding such as red, yellow, and green. The project on simulation-based learning laboratory designed simulation trainings through the use of different tools such as the Emergo Train system, the XVR virtual reality tool, and the DSS or the Disaster Simulation Suite. The simulation training focuses on familiarizing and strengthening the skills on command, communication, and collaboration, and as well as some triaging and first aid skills needed during on-the-spot decision makings in a actual response. The University of the Philippines Manila is not only the health science center of the University of the Philippines system. It also serves as the lead in disaster risk reduction and management for health. In the past, its initiatives include responses to certain events such as Typhoon Sendong and Typhoon Haiyan, just to mention a few. This is done through the Ugnayan ng Pahinungod Manila, which is the volunteer and public service arm of UP Manila. UP Manila also conducts short courses to prepare postgraduate students in disaster management, such as the FEMAP or the Public Health and Emergency Management for Asia and the Pacific course. There is also the PH203 or the Health Aspects of Community Disaster Management. Both of these courses are provided by the College of Public Health. The university will also offer the Hospital Preparedness for Emergency course or the HOPE course, which helps in developing and implementing plans in order to increase the participants' capacity for managing disasters involving hospitals. Currently, there is an ongoing preparation for a HOPE course this December 2021. Finally, the National Institutes of Health houses the Health Emergencies and Disasters or HEAD study group, which conducts researches involving health emergencies and disasters.
It's really easy to use and a very fun learning experience where that kind of technology simulates emergency response, particularly fire and rescue, with the development of that kind of applications to simulate different scenarios amidst in our situations, very timely. So it's highly, for me, it's highly recommended.
I learned a lot from the training, especially during actual operation. For example, in TAL operation, on the first TAL eruption, whole training program was applied there, and also in the evacuation center in Padre Pio. Very important that we were trained for that simulation because of a lot of knowledge was applied in the real operations. I would highly recommend the training because it is also a part of the incident command system, and so that they will understand more on collaboration and coordinations in any event or disasters operation.